So now coming to the independent sample t-test. So the research question of independent sample t-test starts something like this, that is the average BMI or the mean BMI value of population with history of cardiovascular disease and without a history of cardiovascular disease is significantly different or not. The second research question could be, if I want to compare the pain score measured on VAS scale after surgical technique 1 versus surgical technique 2. The third research question could be, does the medical undergraduate student who have got good quality of sleep score high in exam as compared to poor quality sleep? So in all these three questions, what have you seen? That here there is one variable, that is the mean BMI, which is a continuous variable. And we are testing the mean value of a continuous variable across the two category of a nominal variable. So the nominal variable here is the history of CVD, no history of CVD. And the continuous variable is a BMI. Similarly, the pain score is a continuous variable, whereas the surgical technique 1 and surgical technique 2 is a nominal variable. Third one, the marks, mean marks is an example of continuous data. And people like undergraduate student who had a good quality of sleep and who did not have a good quality of sleep, that will be a categorical data. So in all these three questions, what have you observed? That there is a scale variable in each of the research question, and we want to compare the mean of this scale variable across the two categories of a nominal variable. So the appropriate statistical test would be a test which checks the difference in the average score across a binomial variable, and the choice of the test in this case is the independent sample t-test, also known as the unpaired t-test. The other name of independent sample t-test is the student t-test, unpaired t-test, or between subject t-test. So now what are the underlying assumptions of this student t-test or unpaired t-test? So the first assumption is there is one dependent variable which is measured on a continuous scale. Like you have seen in the previous example, the mean BMI, the pain score, etc., or the mean marks. That is the dependent variable which is measured on a continuous scale. Second was one independent variable that consists of two categories. In this case, it is a dichotomous variable like history of CVD, no history of CVD. Student who had good sleep, student who didn't have good sleep. Surgical technique 1, surgical technique 2. So in all these three cases, it is a dichotomous variable. The third assumption is there should be independence of observation. And in the chi-square, we have seen that independence of observation means that the two groups are different. And if you have counted one person in one group, we will not count the same person in the other group. That we mean by the independence of observation. The other underlying assumptions is that dependent variable should be approximately normally distributed for each group of the independent variable. And there's one more concept, the concept of homogeneity of variance. Now in the descriptive, we discussed that variance is the square of standard deviation. Standard deviation measures the difference of individual data from the mean. And if you square that standard deviation, that is the variance. So variance tells you that from the population where you've withdrawn the sample, whether those two population is equal or not. So there should be homogeneity of variance in case of a student t-test. Otherwise, we will use a Welch test value for reporting our result. We'll see that in the subsequent slides. So this is again the concept of outlier. This is just the repetition. So I'm going ahead. I should have. So the null hypothesis in this case is the population mean of the two groups are equal. And the alternate hypothesis is that the population mean of the two groups which we are going to study are not equal. So normality testing, what we do normally in SPSS, when the sample size is less than 50, we use Shapiro-Wilk test. When the sample size is more than 50, we use QQ plot. So the concept of normality for t-test is basically we do it across a group. So the first important point is t-test is a robust test. That's why even if the data is approximately normally distributed, you can run this test. And if the sample size is more, like we have seen, and Ashish was also asking, that even the non-normal data can be tested using t-test. That is the central limit theorem, which says that it tends to accumulate in the center. And if the distribution in both the group is same, like both positively or negatively skewed, then also this test can be applied. And if the direction of skewness is different in both groups, then we should not apply this test and we should go with the non-parametric analog, that is the Mann-Whitney U test. So now the concept of homogeneity of variance. So I have explained that variance is it measures the variation. Variance we will do more in the ANOVA also, but variance is basically the difference, the distance from mean each value, how it is different or the deviant from mean that we measure by the variance, and it is the square of standard deviation. So their underlying assumption of a student sample t-test is the variance in both the population from where the sample have been withdrawn, it should be equal. And we test it by a test known as the Levine test for equality of variance. We have used one name test, that was the Shapiro-Wilk test. Shapiro-Wilk test is for testing normality, whereas the Levine test is for testing the equality of variance. And Levine test tests whether the two sample came from the population with the same variance or not. If the value here also, if the p-value is less than 0.05, this homogeneity of variance criteria is not met. So here also, like Shapiro-Wilk, the value of p should be more than 0.05 to meet this criteria, because the null hypothesis says that there is an equality of variance. So SPSS produces two types of independent t-statistics in the output. The first is when the homogeneity of variance is met, that means it is of equal variance, then you should use standard independent sample t-test statistics, its degree of freedom, and its p-value. If the homogeneity of variance criteria is not met and there is an unequal variance, in that case, you should use the Welch t-statistics, degree of freedom, and p-value. So is it clear to all of you? While giving the command, we will see it in the demo that the SPSS produces two types of t-statistics, standard t-statistics and Welch t-statistics. If homogeneity of variance is met, that means it is of equal variance, then we use standard independent sample t-test statistic, its degree of freedom, and p-value. If it is of unequal variance, then we use Welch t-statistics, degree of freedom, and p-value. So now there are three research designs which are possible. So like mean of the difference between the two independent group, like we have seen in the various research question in the beginning. The second could be the mean difference between the two interventions. That also we can test. That means if you are doing an RCT and if your outcome is in mean and like the change in the systolic blood pressure, like if you want to study any effect of drug on hypertension, addition of a drug, so you may take two group. So there will be initial systolic blood pressure or initial blood pressure, and then after administering drug there will be blood pressure. So there will be difference of these reading 1 and reading 2. So you can compare the mean difference between the two group or the two intervention, or you can again check the mean difference in the change score. So, but the criteria is that there should be two independent groups. Now, here you can see there's a one example, the gender and cholesterol level. So if I want to compare, there is a one example, gender and cholesterol level. You can see that male is having 220, female 340, and there are various examples. I think, is this question is there in the Mentimeter also? This question is not there, I guess. So if it is there, then I think, should I administer it with Mentimeter? No, it's about the 3 study design. So in the first one, so if I go, in the first one, you can see there is a comparison of cholesterol level in male and female. So you can take the mean of male and mean of female, and then you can compare the two. In the second thing, the cholesterol level was measured after 6 weeks in exercise training program in intervention and control arm. So there is an intervention arm and there is a control arm. So between these two arms, you can check the mean level of cholesterol, or you can check the, if there is a two group are there and in both you are performing a pre-cholesterol and a post-cholesterol value after some intervention, and that difference is there with you. So you can calculate the mean difference in both the levels. Like you can take the mean of these value, the difference 24, 42, 14, 15 and 43. This will be one reading, one mean, and the second mean could be 42, 42, 13, 60 and 28. This would be the second mean of the difference. So you can test the mean difference also between the two groups. Is it clear to all of you up till this point? The underlying assumptions of independent sample t-test? And Ritu, I think now you are clear, Ritu, or who asked for this one sample t-test, whether it is necessary or not. So now you can see that if you have got two groups, Priyanka, yes. So if you have got two groups, then you need to apply this independent sample t-test or student t-test. Okay, so if it is clear up till this point, we will move ahead. So this is the question. So before I go for the demo, so the question is, I have to compare the mean systolic blood pressure, diastolic blood pressure, and total protein across the two groups, that is the first order MI and recurrent MI. I have to test whether the variable under investigation follow a normality or not, and to see whether these two groups differ in terms of mean value. So all of you kindly open your menti.com. So there are a few questions. So have you logged in using your code menti.com code? So this is a data set. So now what do you think about the variance of systolic blood pressure across gender? There are three questions on variance. Just to introduce the concept of variance more clearly, these are the hypothetical data, fictitious data, only to make you understand the concept of variance. So if you see the data, there are 11 individuals of male and female gender, and you can see that the systolic blood pressure of all the individual is 124. So the difference of individual score and mean is called the deviation of that score, and when you square all deviation, you get the total variance of the sample, and the square root of this is called the standard deviation that you have seen. So now, can you comment on the variance of this data? What is the variance? So I think two people have answered. Difference of variance of SBP across gender is 0. Difference of variance of SBP is near to 0, and it is far from 0. We don't expect you to calculate, you just have to comment seeing the data. So you can see that there is no difference at all. Each individual value is like the mean of the sample. So you are right that the difference of variance of systolic blood pressure across gender is 0. Coming to the second question, now see this data. What do you think about the variance of systolic blood pressure across gender? So a study reported that overall mean of systolic blood pressure is 124 millimeter of mercury. You see the individual data where you can see that first value is 120, the fourth value is 130. So two values are different from 124. This is also fictitious data only for theoretical process purpose. So what is your comment on variance? So difference of variance of SBP across gender is near to 0, but it is not 0 because there are two values which are different from mean, 130 and 120. So yes, you are right. The answer would be near to 0. Now see this third data. The same 11 people with the same gender. You can see now the individual data. SBP is 120, 110, 124, 140, 130. Now what is your opinion regarding the variance of this data? So yes, you are right that the difference of variance of SBP across gender is far from 0. So if the in the natural course, the difference of variance is never 0. There would be some difference. But if it is very near to 0, that means there is homogeneity of variance. That means we can consider these two variances comparable. They are not very far placed. They're not very different. There's not much deviation from the difference of a one variance with the other variance. So it is near to 0, and that's why the concept of the homogeneity of variance, when the difference of variance across the group is very much similar, that is known as the homogeneity of variance. That means both the population, both the sample from where it has drawn the population, it has got the same variance, means they have we have withdrawn that sample from the same population. So that's why they are comparable. So is it clear to all of you the concept of variance, homogeneity of variance, and the other underlying assumptions? If yes, then we will go ahead. So yes, I think if one participant, yes, I'll take as everybody's